Katie.
Hi.
Welcome back. My name is Dr. Matt. I'm going to do your exam.
Okay.
So, let's see. I have here your file. Can you please verify your date of birth?
Sure, it's March 23rd, 1989.
Perfect. So go ahead and tell me what's going on.
I've been having some stomach pain lately, just like a lot of tenderness and soreness, especially near the belly button, kind of in the middle area.
Okay.
I don't know what it is. Sometimes it gets a little red too, like it isn't today, but a few days ago it turned red for a few hours. And also I'm having back pain, just like in my midsection of the back, kind of on either side of the spine. Just a lot of tension, and I don't know if that's related or not, so that's why I'm here.
Okay. I can definitely take a look and see exactly what's going on and try to find the cause of it.
Okay.
Okay. How would you rate your back pain on a scale of 0 to 10?
I would say it's about 6 or 7.
It's pretty intense. Have you been
Yeah.
taking any pain medicine?
Ibuprofen.
And for the stomach pain, you said it's around the belly button.
Yes.
Have you been taking any medicine?
No, not for that. I'm just not sure what I would take. It's just like a soreness that won't go away.
And is this the first time that you're being seen for this issue?
Yes. Yeah.
Okay. Are you taking any medicine on a daily basis?
Yes, I'm weaning off of Wellbutrin, so I'm taking only like 25 milligrams a day, which is a really low dose, and trazodone at night to sleep.
Okay. Just in case we need to prescribe any medication to make sure that it doesn't interact with what you're already taking. Yeah. Perfect. Okay. Okay, I'm just going to go ahead and put gloves on. And how would you describe your abdominal pain? Is it sharp or dull?
It's dull, yeah.
On a scale of 0 to 10, how would you rate it?
It would be about an 8 if you press on it, yeah.
Okay, I'm going to put this on your index finger. Go ahead and relax. And we'll wrap this around your upper arm. Okay, I'm going to have you uncross your legs. This is going to feel a little bit cold. Blood pressure is a little bit elevated, so we're going to make sure that we have that in your medical records. Heart rate looked normal and oxygenation is good.
Okay.
So I'm going to keep an eye on it. We want to make sure that if it is an infection, we treat it properly with a broad spectrum antibiotics.
Okay.
But first, I'm going to need to take a look and see exactly what we're dealing with to see if there is any fluid that we could test.
Ooh, okay.
Okay. Blood pressure was 135/60. Systolic a little bit elevated. Heart rate was 70 normal. And then oxygenation was 95% on our meter. That's also normal. Alright, let's go ahead and take your temperature. Alright, this will go on your forehead, so go ahead and relax. 96.6. That's a very good sign.
Okay.
Did you take any ibuprofen before coming in?
I did, yeah.
You did?
Yeah.
Okay. Then the ibuprofen might mask any temperature spike if you are having any. Did you experience any flu-like symptoms?
No, I haven't. I haven't felt feverish or chills, nothing like that.
Okay. I'm going to have you lay down and I'll take a look at your stomach to see and your abdomen to see if there is anything concerning, okay?
Sure.
All right. Okay, Katie, is it okay if I lift the shirt up a little bit?
Yeah, go ahead.
And do you mind if I unbutton the pants?
Not at all. Go ahead.
Okay. Let me go ahead and take a light here. I'm definitely noticing a little bit of redness around it. Some swelling. So how long ago did you notice the redness around the belly button?
That happened like 3 days ago. Yeah.
I'm going to listen with the stethoscope. This is going to feel a little bit cold. I would say definitely diminished sounds, especially in the center of the abdomen. And before I palpate, I'm just going to go ahead and take a sample.
Okay.
So what we're going to do is I'm going to sample and culture it to see exactly what kind of bacteria we're dealing with. And also I'm going to check for any fungal infection. going to take a few measurements here. We're looking for inflammation. We want to make sure that all 4 quadrants are symmetric. Going to feel kind of like a pinching sensation. We're looking for hydration status. Okay. So now I'm going to go ahead and check your back. Okay, Goody, I'm going to go ahead and put your hair up so that we can take a look at your back. Okay, before I start palpating, I'm just going to go ahead and listen. This is going to feel a little bit cold. Okay, everything sounds good. I'm going to go ahead and percuss. Going to palpate. We're looking for any swelling. Checking for spine misalignment. I'm not sensing any signs of scoliosis. We're looking at shoulder alignment. Just a deeper palpation here. We're checking for deep infection. Let me know if you feel any kind of pain as I'm palpating. I'm going to take some measurements. This is going to feel a little bit cold. there's definitely some inflammation at the base of the lungs. Although it does look like it's muscular, I don't think it's originating from the belly button. So they might be just two different issues. I'm going to touch you on left or right of your back. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. 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 Right. 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 Left. Right.
And now I'm going to touch you with a different texture. Go ahead and tell me if you feel this warm or cold.
Cold. Warm. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. Cold. Warm. Cold.
And now I'm going to touch you with a warm and a dull object. I'm going to need you to tell me if you feel this warm or dull.
Dull. Warm. Warm. Dull. Dull. Dull.
And I'm going to introduce cold as well at some point. So go ahead and tell me if you feel this cold, warm, or dull sensation.
Sure. Dull. Cold. Warm. Dull. Cold. Dull. Dull. Warm. Dull. Cold. 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 dull, cold, dull, cold.
And now I'm going to introduce a fourth object, which is going to feel kind of like a sharp sensation. This is what it's going to feel like. So go ahead and tell me if you feel this cold, warm, sharp, or dull.
Okay. Dull, cold, sharp, warm, warm, sharp, dull, sharp,
there's definitely a sensory problem. What we could do is to take a sample of the skin here as well and to see if it matches the same bacteria or, flora that's growing on the abdomen. Okay, I'm going to just take one more sample here. We're going to send this to the lab.
Okay.
Okay, this is going to feel warm. And first I'm going to start with a sensory brush. It's going to help to reduce inflammation. You use cupping therapy. This is going to help to stimulate blood flow. I'm going to apply some acupressure therapy around the paraspinal muscles. This will help decrease inflammation in the area and activate the lymphatic drainage. also going to use a gua sha to help release the toxins from the soft tissue. Okay, I'm going to have you get dressed and we're going to talk about what other tests we should do, okay? Okay. Alright, Katie, I'm just going to go ahead and remove my gloves. And I would like to order an MRI for you.
Okay.
Alright, so we're going to do an MRI of the abdomen and back just to double check for any infection and to see if we need to order any antibiotics, okay?
Okay, alright. Sounds good.
And are you allergic to anything?
Not that I'm aware of, no.
Okay, so we're going to do an MRI. And if we can't find the source through the MRI, then maybe we're going to go with a CT scan with contrast.
Okay.
As soon as I have the blood culture ready, I will send you an email and we're going to start a course of antibiotics. I just don't want to start it right away. I want to make sure that we are targeting the right bacteria.
Infection. Okay. All right.
Do you have any questions for me?
No, not at this time, but you've been really helpful, so thank you.
You're welcome.
Yeah.
I'll see you soon.
All right, bye.
To go ahead and put gloves on. And first to take a look at your scalp. I am noticing a little bit of redness at the base of the scalp near the cervical spine. I'm going to start by palpating C1, looking to see if there is any
distension on the atlas. Moving down to axis. C2 doesn't seem to be misplaced. Feeling a little bit of decreased mobility on C3, following on C4 and C5. Noticing a little bit of soreness, starting with T1. Checking for spine misalignment. No signs of scoliosis. No deviations of the spine to the left or right. It does seem to go to the left about a 3-degree angle, but we can definitely keep that under radar and monitor. And your pain, you said, is mostly on the left side. When I looked at the picture, yeah, it did seem that you're having more pain here, lateral on the collarbone and scapula. Also checking scapular mobility. Okay. Okay. Going to gently slide my fingers kind of under. More mobility on the right side. Compared with left. Go ahead and slowly try to touch your chest with your chin. Slowly. So we're looking for any cracking sounds. And come back to normal. And we'll do that one more time. And come back to normal. And again. Okay. We're looking to see if this is neurological, like a nerve impinged, or muscular. Let me know if you feel any kind of pain. Go ahead and tell me when you don't feel the vibration anymore. There. 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 Okay. And to go ahead and start measuring, we're looking for signs of inflammation and asymmetry along the paraspinal muscles. going to focus around these 3 points. I'm going to touch it with 2 textures. One is going to feel dull, the other one is going to feel sharp. Go ahead and tell me what this feels like.
Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Dull. Okay. Okay, Nikki. I'm going to go ahead and focus on the points that first trigger you some pain, and I did notice some tension. The first technique that I would like to use is skin pulling. So what that does is to release some of the tension that is accumulated behind the first layer of the skin, and it really helps to bring in nutrients and circulation to the area. That usually improves the pain level and tension in the muscles. Also, if you do have some knots that could be released through this technique, that's when we can go ahead and tackle them.
to apply an anti-inflammatory oil. This is going to feel a little bit warm. To use cupping to increase circulation in the left scapula. You might see a little bit of redness in the upcoming days, just so you know it's normal and it was caused by the suction. working on the lymphatic drainage as well to help stimulate the release of lymph. This usually helps to bring down swelling. To apply acupressure therapy. This is a sensorial massage. What it does is it helps to stimulate the nerve endings that come through the dermis. And now we're going to take a look at your hair and scalp. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp.
And do you feel this sharp all the way?
Yes.
Does that feel sharp?
Dull.
And now?
Dull.
And now?
Dull. Dull.
Does this feel cold or warm?
Cold.
Does this feel cold or warm?
Cold.
And now?
Warm.
Go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Dull.
And does this feel cold or warm?
Warm.
And now?
Warm.
What about now?
Warm.
Does this feel sharp?
Yes.
Does it feel sharp all the way?
Yes.
Okay. We're gonna go ahead and do a scalp massage before we do hair pulling. Okay, we're gonna go ahead and do hair pulling therapy. That's what we're trying to do, is to create that tension and stabilize the spine. Okay. Okay, we are done for today. I'm going to schedule you for another session in about 2 weeks. Thank you for letting me do this exam on you, and I'll see you back soon. Hi, Alice. It's very nice to see you again. I see here that you're having some problems with numbness on your skin.
Yes.
All right, before we begin with the exam, can you please verify your first and last name and your date of birth?
Yes. Alice Smith.
Okay.
May 10th, 2000.
Okay. Do you have any new allergies?
No.
And when did this begin?
About a year ago.
Okay. And they come on gradually. Are they all over? Is there a specific spot that is more numb than the others?
It's kind of everywhere, all over.
Okay. I'm going to take a look first. Do you take any medicine on a daily basis?
No,
Any vitamins that I should have on file?
just a multivitamin.
Okay. And have you noticed any changes in your vision?
Slightly, yes.
Okay. Is it in both eyes or just one?
Both.
Both eyes. Okay. Any blurriness?
A little bit.
Any changes in your smell or taste?
Yes.
And any changes with your hearing?
No.
I'm going to go ahead and just start the exam. I'm going to first put some gloves on and we'll take your vital signs. Are you experiencing any pins or needles in your extremities? Okay. I'm going to take your temperature. This will go on your forehead. Let me fix that. Okay. 96.6, that's good. And I'll take your blood pressure. This will go on your upper arm. Okay, relax. So we'll go on the elbow. Blood pressure is 120/70. That's normal. Good. Are you experiencing any headaches?
No.
I'll put this here. I'm going to first check your nose, since you did say that you're having some smell problems. I'm going to have you look up for me. And I'm not noticing any redness, so that's good. Now I'm going to go ahead and check patency. Go ahead and breathe in and breathe out. Good. Breathe in, breathe out. Good. I'm going to have you try to identify the smell.
Peppermint.
Okay. That's normal. What about this one?
Spearmint.
Okay. That was sage. Let's go ahead and try one more.
Sandalwood.
Okay, that was like a lemon citrusy. So there's definitely something there. Let's go ahead and check your mouth. I'm gonna have you give me a big ah. We're looking for asymmetry, also redness or swelling. I'm not noticing anything abnormal. Can you go ahead and push your tongue up and down for me? Good. And side to side. All right, that's good muscle coordination. Now I'm going to put this tongue inside your tongue on one side of your cheek. I'm going to have you try to push it, okay? Go ahead and open. And now try to push the blade. That's good. Let's go ahead and do that one more time. Perfect. Okay. And can you give me a big smile? Okay, that's symmetric. And frown. Puff your cheeks. I'm gonna have you keep them puffed. Don't let me unpuff them. Good. Relax. Now I'm gonna have you shrug your shoulders. Good. And squeeze my fingers. Good. I'm gonna have you put your arms like this in front of you. I'm gonna try to push them down. Don't let me do that. Okay. I'm gonna try to open them. Don't let me do that. Okay, I'm gonna try to push them up. Don't let me do that. Okay, good. Relax. And I'm going to put one drop of this on your tongue. I'm gonna have you identify the taste, okay?
Minty.
Okay, that was just a sweet taste. So definitely there's some abnormality with cranial nerves, and we're going to go ahead and just continue and see exactly what we have here. Let's go ahead and check your vision. Do you wear contacts? No. Okay. I'm gonna have you look behind me straight at the wall. Good pupillary response. I'm going to press down on the eyelid. Okay. Now I'm going to have you look right here. And look right here. Okay. I'm going to have you cover one eye. And can you go ahead and read the first sentence?
Hold chart 6 feet from eyes in good light.
All right, go ahead and switch. And read the second sentence.
Check eyes separately, not with and without glasses.
Okay, that's perfect. And what color do you see here?
Red.
Okay. Vision is intact. I'm not noticing anything abnormal. All right, I'm gonna have you now lay down and we'll examine your scalp. I'm going to just take the hair, put it on the side here. Starting with the side. I'm looking for skin issues first. I'm noticing a little bit of dandruff. And some redness. But otherwise, there doesn't seem to be any lice infestation or raised papules. Go ahead and tell me if you feel less pressure here.
Yes.
What about now?
No.
What about here? feeling on that side? Any pressure here?
Yes.
Okay. I'm going to touch it with just a puff of air. Go ahead and tell me if you feel this, yes or no.
No. No. No.
And now I'll touch you with a sharp or dull texture. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
And do you feel this cold or warm?
Cold.
What about now?
Warm.
And now?
Warm.
And now?
Cold.
Okay. Go ahead and tell me if you feel this pressure point here.
Yes.
And here.
Yes.
What about here?
No.
I'm seeing a little bit of redness here on the side where you don't have any feeling. Go ahead and tell me if you feel 2 pressure points or just 1.
2. 2. 1. 1. 1.
And do you feel this sharp or dull?
Dull.
And now?
Dull.
And now?
Sharp.
What about now?
Dull. Sharp. Dull.
Go ahead and tell me if you feel this puff of air, yes or no.
No. No. No. Yes. Yes. No.
Okay. Go ahead and tell me how many taps you feel, 1 or 2.
2. 1. 1. 2. 1. 1. 1.
feel this pressure point here?
No.
What about here?
No.
And here?
Yes.
Does this feel cold or warm?
Cold.
And here?
Warm. Warm. Cold.
Okay, go ahead and tell me if you feel this 2 or 1 pressure points.
2. 2. 1. 1. 2. 2. 2. 1.
Does this feel sharp or dull?
Dull. Sharp. Sharp.
Okay, do you feel this all the way?
Yes.
What about now?
No.
And now?
No.
Go ahead and tell me if you feel this pressure point here.
No.
What about here?
Yes.
And here?
Yes.
And here?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold.
Good. And here?
Warm.
And here?
Warm. Cold.
Okay, so it looks like around here we're gonna be focusing. Go ahead and tell me if you feel this 2 or 1 pressure points.
2. 1. 2. 2. 1. 2. 1. 1.
Okay. And do you feel this sharp or dull?
Sharp.
And now?
Dull. Dull. Dull.
Okay. Go ahead and tell me if you feel this all the way down.
Yes.
And now?
Yes.
And now?
Yes.
Go ahead and tell me how many puffs of air do you feel? 1 or 2?
2. 1. 2. 2. 2. 2. 1. 1.
Okay. Okay. Go ahead and tell me if you feel this sharp or dull. Sharp. And now. Dull. And now. Sharp. Sharp. Dull. Dull. Sharp. Sharp. And does this feel cold or warm? Cold. 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 Warm. Warm. Cold. Warm. Warm. Cold. Cold. Okay. Let's go ahead and take a look at your back now. I'm going to first palpate the spine, looking to see if there is any abnormal curvatures, as well as any inflammation around the vertebrae. I am noticing a little bit of redness that shows some constriction in the blood vessels. Checking for any pulsations or changes in skin texture. Just slowly tapping on the spine. Looking for abnormal neurological responses. going to touch it with a cold texture. Go ahead and tell me if it changes in intensity.
Yes.
And where did you feel it colder?
At the top. Yes. No. Yes.
And where did you feel it colder?
At the bottom.
Was that the same?
Yes.
Go ahead and tell me if you feel this pressure point, yes or no.
No. No. Yes. No. Yes. No. No. No.
I'm going to touch you with dull textures. Go ahead and tell me if you feel this on the left or right.
Right. Left. 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 Right. 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 Left.
Now I'm going to touch you with two textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be a little bit sharp, like this. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Sharp.
And now I'll touch you with a wet or a dry texture. So go ahead and tell me if you feel this wet or dry.
Dry. Dry. Wet. Wet. Wet.
Now I'm going to touch you with 2 sensory brushes. Go ahead and tell me if it changes in texture or intensity as I'm sliding it down.
Yes.
Okay, where did you not feel it?
In the middle.
In the middle. Did you feel it all the way?
Yes.
Okay.
Yes. Yes. No.
Where did you not feel it?
In the middle.
In the middle.
Yes. No.
Okay, Alice. Just checking your lymph nodes to make sure that they're not constricting any nerves. Sometimes if they're swollen, that could happen and could trigger a series of symptoms. Just gently palpating to see if there is anything concerning. I'm going to check for any TMJ disorders. Go ahead and slowly open your mouth as wide as you can. And slowly close it. Let's go ahead and do that one more time. And slowly close it. Okay. I did not feel any clicks. Did you hear any popping in your ears?
No.
Alright, I'm going to touch you on your face. So we're checking for any sensory problems again. Go ahead and tell me if you feel this on the left or right.
Right. Left. Right. Left. 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 Both.
Did you feel that equally on both sides?
Yes. Both.
And did you feel that equally on both sides?
Yes. Equally. Equally.
Okay. Go ahead and tell me if you feel this pinch here.
No.
What about here?
Yes.
Okay. Let me know if you feel this pinch here.
No.
And here.
Yes.
Okay, so it's more localized on the left. What about here?
No.
Here.
No.
Here.
Yes.
Here.
No.
Here.
Yes.
And here.
Yes.
Here.
Yes. Yes.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it.
Tell me when it stops.
It stopped. 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 Stopped.
Go ahead and tell me which position here is louder, 1 or 2. This is 1 and 2. 1 and 2.
2.
Okay. I'm going to touch you with 2 pressure points. Go ahead and tell me if you feel this 2 or 1. 2. 1. 2. 2. 1. 2. 2. 1. 1. 2. 2. 2. 1. 2. 2. 2. And now I'm going to touch it with a sharp or dull surface. Let me know if you feel this sharp or dull. 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 Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Now go ahead and tell me if this feels dry or wet. Wet. Dry. Wet. Wet. Dry. Dry. Wet. 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 Dry. Wet. Wet. Dry. Dry. Wet. Okay, so it does seem like the dermatomes on the left side, more like in the middle, are compromised. I'm going to go ahead and check your arms now, and then we'll move down to the leg area. Go ahead and tell me if you feel this equally on both sides.
Yes. Yes. Yes.
Okay, I'm gonna have you flip your arms like that. What about now?
No.
Okay. Where do you not feel it?
On the left.
On the left. What about now?
No. Yes. Yes.
Okay. So we're going to focus on those parts. Go ahead and tell me if you feel this bubble there, yes or no.
No.
Does this feel cold or warm to you?
Cold.
And now.
Warm. Cold. Cold.
Go ahead and tell me if this feels sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Does that feel cold or warm?
Cold.
And now.
Warm. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Okay. So go ahead and check your reflexes here. Relax your arm. Okay. I'm going to check your reflexes here. So I'm going to slide my arm right under your knee. Go ahead and relax. Good. A little bit of diminished reflex on the right side. Okay. Relax. Good. Okay. Very diminished on the left side as well. And now go ahead and relax your foot. We're just going to put it on top of the other one. Perfect. And okay, good. Same thing on the other side. Okay. I'm also gonna check Babinski reflex. Good. And we'll do that one more time on this side. Okay. And go ahead and try to pull your feet towards you, okay? Good. Now try to push with the pads. Okay. Go ahead and try to open your toes. Okay. Try to curl your toes around my fingers. What about the big toe? Alright, very diminished on the right side. Go ahead and tell me if you feel less puff of hair.
Yes. No. Yes. Yes. No. No.
Does this feel sharp or dull?
Dull.
And now?
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay. So cranial nerves are honestly all over the place. I'm gonna have you stand up and we'll talk about what we should do next. All right, Mrs. Smith, we're going to just order a few more tests. We're going to do a CT scan. We're going to check abdomen and neck and head. Now, I'm going to prescribe some medication as well. I think it's going to help to bring down some of the inflammation that you're experiencing in some areas of your body. And you might experience a little bit of side effects. Those are normal. I'm going to go ahead and write that down for you so that you, in case you do experience that, you don't get alarmed. And let me know if you have any questions for me, okay?
Okay.
All right.
Thank you.
You're welcome. It was very nice to see you. Hi, Casey.
Hi.
How are you feeling?
I'm okay.
We're going to do a full body assessment, and then I will see what kind of treatment we need to do. But you're here for a lymphatic drainage, full body massage, and I'm going to help you with detoxifying your muscles and helping to release some of that tension.
Okay.
I'm gonna have you first relax.
Okay.
You can go ahead and close your eyes, and we're going to start with 3 deep breaths in. And try to use your diaphragmatic muscles, which are more abdominal compared with thoracic, which you're doing right now. That's better. Okay, I'm going to do first just a gentle abdominal palpation. What this does is to kickstart the digestive system. It helps to stimulate enzymes that facilitate proper digestion. Okay. Now I'm going to focus on the scalp area. I'm going to have you lift your head up so that we can just rearrange the hair. Perfect. also looking for any swelling. And I'm not noticing any redness around the scalp area. Today's treatment also helps with any asymmetries that you have on the body. So sometimes the musculature can be so tense on only one side, since the brain prefers to use more capacity the right side or the left side. And by stimulating the nerve endings, we are allowing for both hemispheres to relax. This scalp stimulation technique also helps with face lifting, and it tonifies the muscle mass. Going to put gloves on. I'll start by assessing your face. Also looking for asymmetry. Noticing slight swelling on the right side. And the face does look a tiny bit asymmetric on the left, under the cheek. So I'm slowly going to assess the orbital fossa and sinuses that are situated right under the eyes. Palpating lymph nodes in front of the ears. We're also assessing for any fluid accumulated. Slowly palpating submental lymph nodes under the chin. And above the clavicle area. Going to use a neurological hammer to trace the skin and see if I'm noticing any increased swelling. This is skin tracing technique. It's very useful in identifying those spots that need to be focused on. Looking for any blanchable edema redness or puffiness, and that could indicate lymph fluid that has been stuck under the skin. Going to apply a detoxifying oil. I'm going to start with the neck and arms. This is going to feel a little bit warm in the beginning. Just going to put the straps a little bit on the side. Okay, this is going to feel a little bit cold. This helps to stimulate nerve endings and decrease inflammation. The roller is very gentle and just slowly pushes the skin and applies gentle pressure. Going to use cupping therapy to stimulate blood flow. This also helps to detoxify muscles and lymph nodes. Alright, I think we can go ahead and move down. Okay, warming up the oil. This helps to reduce inflammation and it facilitates lymph drainage. So you'll definitely notice a flatter stomach and less bloating. This is going to feel a little bit cold. We're applying cold therapy. This helps to decrease tension in the abdominal muscles. Just slowly applying pressure point therapy on the soles of your feet. This helps to balance the musculature. And any inflammation that you are having that's coming from the feet, we're definitely covering it now and making sure that we are balancing and increasing mobility. Okay, I'm going to have you turn on your belly and we're going to work on your calves now. Okay, applying the same anti-inflammatory oil, focusing on the calves. This helps to increase immunity and circulation in the whole body. Okay, using cupping therapy to first detoxify, and after that we're going to perform lymphatic drainage. This is definitely a longer treatment. Sometimes we just like to focus on certain parts of the body instead of doing a full body. But in today's session, I decided that it would be better to first start with all the parts. That way we can help you reach the goal that you want in a faster session. Alright, Ginger, I'm going to first put gloves on and then take a look at your spine and your back. I read in your file that you're having some more pain. So let's see what we can do about it and exactly what we're finding. I'm going to go ahead and put your hair up so that we can expose the spine. I'm going to start by palpating the cervical spine. Seeing some redness. That could be some lack of oxygenation in the atlas and axis. Feeling for the nucleus. A bit of swelling here. And there's a lot of pain over here, right? Normal curvatures of the spine. Take some measurements. looking for asymmetry. That would indicate an imbalance. Checking spine mobility to see if there is any tension in between the muscles. I'm going to take a few more measurements, looking for more inflammatory markers. So we're measuring the parts where we noticed some redness. I'm going to start with an exfoliation part before we begin treatment. I'm going to start with skin pulling before we apply any type of oil. This will help to increase circulation in the areas that we want to work on. It will definitely help. So skin pulling brings blood flow to the surface and it helps to release toxins.
Usually the redness that we see means just a lack of oxygen in those cells. Going to apply a mineral magnesium oil, starting with the base of the skull. This is going to feel maybe a little bit, maybe like a tingling sensation, and the upper side. Magnesium is usually very easily absorbed by the skin, and it helps to relax the muscles. We're going to activate the lymphatic system, allowing for the lymph to be drained and removed from the circulatory system.
This is a very gentle adjustment of the spine, providing very light pulsations. We're trying to activate the paraspinal muscles. This further helps to desensitize the nerve endings around the paraspinal muscles and also to increase circulation in those areas. Applying just a gentle scratching. going to apply acupressure, starting with cervical spine, gently applying pressure for a few seconds. That usually activates the main organs as well. It helps to detoxify the body and to lower inflammation. I'm going to apply a little bit more oil. I'm going to use suction cupping to increase circulation as well as part of the overall treatment. And this helps to lower the soreness and to decrease the pain signal. So it's definitely going to feel less sore in the next coming days. It's going to feel a little bit cold, but it helps to stimulate blood flow as well. So I'm going to apply multiple pressure points, focusing more on the trapezius muscle. It's also going to feel a little bit cold. Going to go ahead and do a gentle adjustment, working on the upper back muscles, just trying to put the joints back together. I'm going to have you take deep breaths in, okay? This will allow for better oxygenation